Hello, and welcome back to another episode of Patient Conversations with Leah. Today I have James with me, and I'm very excited to talk to James because we actually both live in Kentucky. And James and his wife and I have talked since right around his diagnosis time. So it's kind of a full circle moment for us. So I want to introduce you to James. I'm going to let James take it from here. He was diagnosed in March of 2024 with stage 4 lung cancer. And I'm going to let him tell a little bit about his diagnosis, and just who he is in general. So good morning, James.
Hey, good morning, Leah. It's good to talk to you today.
Good to
Thanks
talk to you
for
too.
thanks for the invitation, and I appreciate it.
Oh, we're honored.
And I'm glad to be here because I'm assuming that a lot of your audience are going to be people that perhaps have been recently diagnosed or had a loved one recently diagnosed, and are reaching out to the community and looking for resources and that kind of thing. So I'm happy to share. Um,
Thank
I,
you.
for me, my background is I was originally from Georgia. And then I joined the Army at 18, basically made a career of that. And so did, just a little over 20 years and then retired. We settled here just outside of Fort Knox, Kentucky. And we have 3 kids. So 2 of our kids were born overseas in Spain, and youngest was born right here in Louisville. And, went ahead and shifted careers. When I left the Army, I went into renovating properties. For me, I was very into fitness, being in the military, and continued that into my retirement. So I would wake up in the morning, have a weight set in the garage kind of thing, work out, go for a run, and then do, work. And my kids are in elementary school and middle school. So one day I developed a wheeze. The whole family caught a cold and got sick. That kind of thing happens. And I had a little wheeze that just didn't go away. Didn't affect my run time, didn't affect my fitness. I didn't feel any symptoms. Just had this consistent wheeze in my breathing that didn't go away, didn't improve. And finally, my wife, Maria, insisted that I get it checked out. She actually made the appointment because I'm a typical guy, and I was like, it's not affecting me. It's fine. I don't know. It's just a thing. Because at that age and at that fitness level, never entered my head that it could be something like this. So an X-ray turned into a CT scan, turned into a diagnosis. The beginning of that, though, was a rough ride. There's an element of shock, as I'm sure if you're watching this, you're aware, and Leah, I think you certainly will attest to that, that when they tell you that, you say, I'm sorry, excuse me, what? So the first step was to do a biopsy. So it was my local health professional that I saw first, and she's actually an APRN. So she did the X-ray, or referred me for an X-ray and a CT scan, and then said, okay, I'm going to refer you to the local cancer center, and we need to do a biopsy. I think that's going to be the first step. So she recommended a doctor there, pulmonologist, that we misunderstood what the situation was with him, and I'll explain that briefly because this started a chain of events that we'll talk about when it comes to self-advocacy, that concept. In the beginning, you're thrust into this situation, this topic that you don't know anything about. If you're, I think, like most people, maybe a relative in your family has had cancer, you've seen advertisements, that sort of thing, you're aware of it. Maybe it has touched your life previously, but as far as the details of your diagnosis, it's a whole new uncharted territory. For me, it was. And the stakes have never been higher. So you're put in this situation where you're asked to make decisions, you're offered options, things are explained to you, but ultimately they're looking to you to say, would you like to do this or like to do that? And you don't know because it's something you don't know anything about. You may as well sit me down at a table full of gangsters and say, hey, we're going to play this complicated card game and your life depends on it. And you're saying, well, what are the rules? And they're like, all right, you've already dealt the cards, pick them up, go. You don't know.
It's a great analogy. A great analogy.
So you immediately have to start asking questions. We didn't ask the right questions in the beginning because we just didn't know. So it turns out the pulmonologist is not an oncologist. Okay, that's pretty clear. But what we don't realize is the pulmonologist doesn't even communicate with the oncologist in the same hospital, the same health system. So the biopsy is conducted, and he's saying, well, when we get the results, then we'll know more about it because they're going to do genetic sequencing on it. But I can tell you from these initial results that it seems you have adenocarcinoma, non-small cell lung cancer. Okay, so with that little piece of information, we begin researching. You're going to scare yourself. You're going to get on the internet. You're going to look up things. They said, okay, these results will be back in about 3 weeks, a month maybe. Okay, so for that whole period of time, you're living in anxiety, waiting for the results. In our case, 3 weeks comes and goes, and we communicate with the pulmonologist, ask him, what are the results? When are we going to get them? He says, well, that's the oncologist has to submit that. I don't actually submit it. What? So it's
Right.
even been submitted at that point. Incredibly frustrating.
Yeah, and it's not, as you said, you're like, there's an element of shock to this. You're not even like able to think clearly. You don't know what they're talking about. And then you're supposed to know that you are to tell the oncologist to order, to get you the results. It's a very frustrating um, system for sure.
Exactly. And so there's bureaucracy to navigate within, not even talking about insurance or any of that yet, just the medical system itself, the medical professionals. So once we got that sorted out, they said, okay, based on the results and the CT scan, this is where my own advocacy initially was wrong-headed. I'm a military man. I spent my career in the military, and I'm very action-oriented. I was a pilot. I tend to be type A, checklist-driven kind of personality, and
That's me too.
yep, and I'm very much about I don't want to wait. I want to take action. So when I look at the situation, I'm putting it, I'm building a framework that I can understand in my mind, which is sort of a tactical situation. I'm like, okay, if I have a tumor here, I know it's shedding cells. This is what we've learned anyway. We're reading on the internet, looking, and we're learning enough information to scare ourselves and be dangerous in our decisions. That's what's happening in the beginning. So despite being educated, I have a master's degree from Boston University. My wife has a university degree from Galway University in Ireland. We're not uninformed people, but we just don't know this topic. So we're working on trying to educate ourselves to make the right decisions. So I'm pushing for surgery. I just want to get this out of you. They initially agreed. We meet the surgeon, we discuss it. Still haven't met an oncologist because, again, no one's explaining these details of this surgeon does this surgery, but he's not actually an oncologist. So the original pulmonologist ordered an MRI of the brain for the surgeon at their request before they conduct the surgery. So I go and do the MRI, and as I'm driving home, literally driving down the highway, and I've gotten off the interstate now and I'm on the side roads, the pulmonologist calls and says, hey, we got the results of that MRI. We just looked at it. So I pull over to the side of the road. Just whipped into the first place I saw, which happened to be this really kind of grotty gas station. Pull up next to a dumpster, and he tells me, you have a brain tumor, you're stage 4, surgery is not an option for you. And there you go. So
Yeah, your whole idea of things that you thought you knew just flipped again.
completely. So I hang up the phone, and I think, how am I going to explain this to Maria? Okay, that changes things quite a bit. I don't know what the future looks like right now. So we get the appointment with the oncologist, who says, hey, you know, you need to do systemic treatment, but we don't know what that looks like yet because we don't have the results of the biopsy. I'm submitting it now. I mean, we're a month into this now, and I'm where I was a month ago, basically.
Right.
Except now I've had multiple appointments, met a lot of people, and still nothing's happened. And my frustration level, my anxiety, all of it is absolutely to the top of the scale. And what I've learned is, in terms of biology, it's okay. 1 month, in most cases, it isn't a make or break kind of a situation, in the bigger picture. So if that frustration, if somebody's watching this, experiencing something similar, take a deep breath. It's okay. These things are going to happen. It's part of the learning curve. But one of the things that caused us to discuss here in the household is we need a second opinion. So
Yes.
Maria did her research and said, "Hey, here's a national cancer center. I want to see who do I think is the best doctor there? What's the consensus on the internet? That's the person we want to see. Let's get there." So she made the phone calls, lots of discussion with the insurance companies and all that. But in the meanwhile, we said, "Hey, for a consultation, get on the plane." So we made the appointment and got on the plane. And that took me to a national cancer center. Should I say where?
Oh, sure. You could say,
Okay, so I went to MD Anderson in Houston, Texas. So the thoracic oncology department there is amazing. The whole institute is amazing.
I know I call it the Disney World of cancer institutes, not because everyone wants to be there, but it's like the happiest cancer institute you'll ever be at. And there's tons of terrible things that happen there and sad things, but
Mhm.
people are just different there. The staff, from the person who opens the door to the person who does your CT to the person, the doctor. I mean, everyone is like top notch. And so I
Yes.
don't know, just it's just a good place. I agree.
The phrase I used, I did the same thing. I had a substitute name for it. I said it's the NASA. It was like
There
visiting
you go.
NASA. It is a research, place of research, and it's massive. I mean, it's got its own power plant. It's just a complex of buildings and facilities and different specialties. There's so much specialization and experience concentrated in such a dense place that they just have the expertise. So, and I think you'll find that at different national level cancer centers.
Hmm.
So I went there and it was just night and day, just like you just said. The attitude was completely different. And it is life and death stuff we're talking. So I'll share what the doctor said to me when we sat down. His first question, he said, "How are you feeling? What symptoms do you have?" This sort of thing. I explained that I don't have any of them, just this wheeze. And he said, "Okay." He goes, "Let me put your mind at rest." And he pointed to my chest, like with his finger pointed at me. And he said, "That's not going to kill you." And he pointed to my forehead and he said, "And that's not going to kill you." Okay. He says, "What's changed right now is your knowledge." He goes, "What was different yesterday from, the day before you were diagnosed to the day you're diagnosed is your knowledge. Something's wrong, whatever. But mainly nothing's really changed. So we're going to do the genetic testing because we did a blood biopsy. It was erroneous. It came back with a misdiagnosis. That was,
Mm.
and I left out, sorry. So we initially had a misdiagnosis as well of the mutation that I had. They did another blood biopsy there. And then we waited for the tissue results, but they got on the phone, called the actual lab that had my biopsy to confirm how much tissue they had, was it sufficient, and that was all while I was there. They said, "Hey, if it's not sufficient, we're going to keep you here and do another biopsy if we need to." Like they immediately took command of the situation and were very calm, level-headed about it, and they explained it in terms that, for me, made sense. They were talking numbers, giving me examples of how many cells, this kind of thing. That resonates with me. Facts, figures, something concrete I can know. And then at the end of the conversation, I was convinced, as was Maria. He said, "Can I just be your patient?" This just went from a consult to an adoption. Will you write the treatment plan and be my doctor for this? And I'll use my local cancer center just to administer the treatment plan that you lay out. So they got on the telephone, called the local oncologist. They had multiple discussions about exactly what to do. And then MD Anderson got back with me and said, "Okay, here is the plan."
And it's such a relief when somebody finally takes control that you can trust because, I think our guts kind of tell us when things are not quite right. And like you said, you're sitting there and you're learning, like the oncologist and the pulmonologist don't communicate. And that's an unsettling feeling. Your gut is telling you that. And by listening to your gut and advocating for yourself, researching, once you find the right fit, and it doesn't have to be at MD Anderson, there's lots of great oncologists, right? But
Absolutely.
once you find that fit, it's like such a relief. It's like a weight has been lifted off your shoulders because no longer do you feel like you're trying to drive your treatment plan and all the things that are going on. You're finally a passenger. You had a lot. I mean, that is a lot. A misdiagnosis. We're talking about blood biopsies for people that don't know or aren't familiar. There are two ways that biomarkers are tested for in lung cancer patients. One is through tissue biopsy, where they remove part of the tumor, your primary tumor, typically, and then they send that tissue off to the lab, and it comes back with potential biomarkers that would guide treatment plans. The other way, and it's a newer way, is called a liquid biopsy. Some people call it a ctDNA. And what they're looking for is cancer shed in the bloodstream that tells what kind of mutation might be driving the cancer. And we, I think, as a patient group, have population, I could even say, we have learned that sometimes the liquid biopsies or the ctDNAs are not as reliable
Correct.
as the actual tissue biomarker. So I think a lot of hospitals are doing both kind of simultaneously because it is easier to get blood and whatnot. And if then also the tissue is a little bit more invasive, you have to have a bronchoscopy or a needle biopsy depending on where it is. So, and I mean, everybody's kind of at different health levels when they're diagnosed as to what their body can handle physically too, which would influence that. But that's good to note that there really are two tests
Mhm.
right now that people can have done to find out if they have a driving mechanism in their lung cancer. Thank you for pointing that out.
Yeah, that was a big deal.
Yeah. Yeah. That's always a big deal because nowadays with lung cancer treatment, it's not just standard, you're gonna go on chemotherapy and everybody does the same thing. So, they really wanna know specifically what is driving your cancer, if there's a biomarker. If not, then there's a different plan or if it's small cell or whatnot. But having that biomarker information is very important
And that
before
and
starting treatment.
that was absolutely, absolutely critical. And it was that getting that second opinion and telling the first doc, yeah, and it takes a little bit of uh, you have to tell your local oncologist in a polite way that, and they understand that. That's the thing. They completely understand. They will probably recommend it. So don't feel any bashfulness about. And this is not, of course, to you, Leah. This is to whomever's watching this. Is to say, don't be bashful about that. Say, listen, I love you, I trust you. That's great. I need to get a second opinion on this because it's really just, it's not a, you're not questioning the diagnosis so much as just getting another set of eyes on this. And they
Right.
may offer a different test. Because even with that, the next generation sequencing, there are different laboratories that do it. Interestingly, you can take a sample, two samples from the same person at the same time, send it to the lab, and there is a chance that one test, even at tissue, which is the gold standard, could miss something and the second one catches it. So if at all possible, that tissue sample is really important because that gives the best chance to identify correctly any driver mutation.
Correct. I agree. And, a lot of labs do save the tissue for a number of years or a number of months, whatever their policy is, which is great because, like, when I was diagnosed 5.5 years ago, some of these biomarkers that people they're finding now weren't even really known that could be a part of lung cancer.
Right.
So it's also comforting to know that there is a window of time where they can take that tissue and retest it because science is moving so quickly. This is all great information. I think, you are an example of why being an advocate, being brave and standing up and saying, I'm not questioning you. I just need another set of eyes to make myself feel better. And that's a lot of times how I would phrase it is, I know you are doing the right things or, you're up to date on your knowledge, but for my own sake, I just need to make sure somebody else is looking at this too, because sometimes people look at it different ways. So I thank you for sharing that because it's an integral part of diagnosis, especially in a late stage cancer. So I do appreciate that. And I thank you for being here today. This has been great. And this, for people who are watching, this is a 3-part series with James. So this is just part 1. So if you would like to hear the next set of conversations that we have, please like and follow. And that way you don't miss it because they don't come out on the same day. They get released a few days apart. But in our next episode, we're going to talk a little bit about the different types of treatment that James has been on and what that means in terms of living a full and healthy life. So, James, I look forward to next time and thank you so much for your time this morning.
You're very welcome. Thank you for having me on.